Well, here we are today with Dr. Hawary, a dentist from Newport Beach here in California. Dr. Hawary, how are you doing?
I'm very good, thank you.
All right. Well, Dr. Hawary, let's get right into it. You're a dentist, and as patients, when we're looking for a dentist, on one hand, we believe that a dentist is a dentist is a dentist. All dentists are the same because, after all, the government licenses you. On the other hand, we kind of know and we realize that not all dentists are the same, and especially when it comes to philosophy. So let's talk about the philosophy in your practice, because different dentists for sure have a different philosophy. Go ahead and tell me a little bit of, what you base your practice on and your values. Maybe you even tell us why you became a dentist. Maybe that fits well into it. Go ahead.
Well, dentistry is an art, and I consider myself as an artist from, since I was a kid. I'd love to paint and draw and do, art stuff, and dentistry fit that very much. I always want to be a doctor as well, so I think dentistry combined my passions. Dentistry's philosophy in my practice, it's an art and science combined, and I would love very much to give a very beautiful aesthetic restorations, whether it's a complete smile makeover or just a tooth in the back. I would really like to challenge myself to make it look as beautiful as it can be. Now, my philosophy in my practice is to be as comprehensive and as preventative as I can, because I believe that when we prevent a problem, it's much easier and better for the patient than treating the problem itself. So we try to avoid letting things go and deteriorate and become a real issue that we have to spend a lot of time, money, and pain for the patient to resolve that issue that resulted from not being very preventative.
And that makes, of course, a lot of sense. So you're definitely right that probably all profession, I come from the mechanical engineering field, even people don't realize that even that has art with it. But the point is, in dentistry, so much the more, because yes, clinically everything can be perfect, but you gotta. It's not just a measurement of how a tooth looks like. There's a lots of things do it, and of course we know that a small displacement of a tooth sometimes can start a person having headaches and all kinds of stuff. It's really a little bit more than just putting a tooth in and making it basically looking nice. There's nice and there's beautiful. I got that. And when it comes to preventive, obviously we know, or we should know, that in the whole medical branches which there are, from being sick to the stomach, having a heart problem, from the blood, from diabetes, from a simple cold, dentistry is the most preventable one. Dentistry has the most measured outcomes. So at any stage, at whatever problem a person has, he can stop almost immediately the deterioration of the problem. Would that be a correct statement, Dr. Hawary?
Well, absolutely. A lot of times it's a very minor crack in a tooth that can end up really to a very big problem, from breaking a tooth to a root canal to even sometimes losing the tooth, while being very preventative and taking some proactive measures in the right time would lead to a very minimal restoration that would restore the problem and prevent it from getting to any bigger, more painful or more expensive or even more traumatic psychologically if you lose a tooth in your front or something like that, that can be avoided by a thorough dentist taking the right measures in the right time.
Good. So preventive dentistry is one of your main key functions, and that's probably very nice to hear for your patients, because obviously an ounce of prevention is worth a pound of cure, and the problem just becomes bigger and more expensive. So that's wonderful. And you consider yourself to be an artist who loves to, enhance the smile above and beyond clinically perfection. Wonderful. What made you becoming a dentist? We have another minute here. What made you, why, you said that you're an artist and you want to become, a doctor. And it's that really what kind of encouraged you at a very young age to become a dentist, or down the road? I have talked to some people, they knew at the age of 5 what they wanted to be. How did it happen with you?
Yeah, I always liked the medical field in general, and I always liked very much or excelled in anything that I do with my hands. So it showed that I can choose a completely different profession that based on artistry. And the best thing that I found, and as I grew up, I learned that dentistry can combine the science and the artistry as well. It allows me to use my skills in using my hands in prepping the teeth in a nice way, to being able to get a beautiful smile design and changing patients' appearance, which is my really strong passion, where I see it's like being able to design somebody's smile and change his face and give him a new confidence and new face and a new appearance based on your imagination. It has a lot of artistry. Now, it can be as big as changing a smile, but it can be even more challenging sometimes just to match one tooth central in the front that has a lot of colors and make it completely blend with the natural dentition. Sometimes it's
wonderful. It's a smile, basically a smile by design.
Absolutely.
A smile by design. Well, look, wonderful to hear. And you, however, also are servicing full families, children, and who can, families, moms can come with their children. Great.
Absolutely. Well, when we talk about cosmetic dentistry as a passion, cosmetic dentistry, some people, in my opinion, think that cosmetic dentistry is just apply if I want to make a smile makeover. But in my practice, cosmetic dentistry can be applied to a single porcelain crown in the very back tooth that would make it blend with natural teeth. So being picky an artist and like what you do makes you really want to give a beautiful restoration no matter where it is. So you can definitely apply these skills and these good eyes, excellent technicians that we use in getting any kind of dentistry, from just a filling to a posterior crown to a smile makeover. It doesn't matter. Whoever sees the beauty can see it anywhere in the mouth.
Beautiful. And I think one of the most important things is to work with somebody one way or the other way, whichever way you do business with any person, to do business with somebody who loves what he does. There's just nothing more important than doing that. People who just love what they do, because by doing so they'll become innovative all the time, creative all the time, and they want to do always the best because they love it. Thank you very much, Dr. Hawary.